Hi, I'm Ben Adler. I'm a consultant geriatrician here at University Hospital Wishaw, and I'm also the Deputy Clinical Director for Medicine here. When I look back at the last year, obviously it was full of challenges for me and all my colleagues here at Wishaw, but there have also been a huge number of positives to come out of this. In the Department of Geriatric Medicine alone, we had to be able to adapt very quickly. We had to move our stroke unit. We had to open a ward at Udston and then close it again. And we had to adapt our clinical pathways to take on much more of the non-COVID work in the first phase. In the second wave of COVID, we had to adapt and open our own COVID unit. All these changes have led to some positives. I think we're closer as a team, and we feel better equipped and more prepared to make the changes going forward that we need to make to ensure that we develop frailty services for older people that will provide the best services for this vulnerable group of patients.
Hi, my name is Hazel and this is Ashley. We're acute care elderly specialist nurse. She's also known as ACE nurse. She's here at University Hospital Wishaw. During the COVID-19 response, we had to change the way we worked dramatically to help the service and make sure the patients were getting looked after. So one of the things we've done was work as ANPs down at Udston Hospital, which was the off-site hospital we created to help the acute beds have more capacity. We also received at the front door in the emergency care ward Monday to Sunday, which is new for us, to help the care elderly patients get geriatric input from the get-go. We're still doing Monday to Sunday receiving from the care elderly point of view, because we realised how beneficial it was for the patients.
So overall, the COVID pandemic has put a bunch of challenges for our team and our frail elderly patients, but it's shown that we can still continue to push through and work our hardest for our patients and our team.
Welcome to Ward 12. We opened in December 2020 as a geriatric orthopaedic rehabilitation ward. Due to the pandemic, we had to quickly adapt our ward to become an over 65s COVID and non-COVID rehabilitation ward, and then to over 65s long COVID rehabilitation, and now back to geriatric rehabilitation. Many of us were brand new to the NHS, some of us brand new to nursing. We got through the challenges COVID gave us by working together, supporting each other, with good communication and guidance from our senior charge nurse and our deputy charge nurse. This has enabled us to become the strong and supportive team that we are.
Like many other departments, COVID presented a range of challenges to the surgical and anaesthetic clinical pharmacy team at University Hospital Wishaw. Not only did we have to upskill pharmacists to support the pharmaceutical care to intensive care patients, we had to support the centralisation of both emergency surgery and orthopaedic trauma patients to this site. We regularly liaised both locally and nationally to mitigate medicine shortages in critical care areas and wrote a range of clinical protocols to support the ward staff.
ECMA had not yet been rolled out in Wishaw, therefore all clinical pharmacy services were provided on the wards. This ensured that all nursing staff, medical students and medical staff, especially those that had been redeployed from other areas, were effectively supported in all medicines related queries directly on the wards. We also provided training on perioperative diabetic patient management, just in response to the increased number of surgeries that was happening at our site. We were also awarded the Scottish Pharmacy Award Hospital Pharmacy Team of the Year in 2020 in recognition for all our work across the surgical, orthopaedic and anaesthetic areas.
Hi, my name's John Milne. I'm the lead cancer care pharmacist for NHS Lanarkshire. I'm just going to give you a wee chat about what we were up to during the pandemic. So obviously we had to change the way we worked is the main thing, and the main principle was that we would want to avoid contact as much as possible with vulnerable patient groups, and also with making sure that our staff are protected as well. So there was quite a few challenges here because our vulnerable patient group is pretty much everybody that's getting chemotherapy with cancer. So we introduced new ways of working, and some of these ways we're going to keep going with, I think, beyond the pandemic, because we've found that they've helped the service enormously. So the first thing that we've been doing is changing the face-to-face appointments for patients coming to clinic. So a lot of patients these days are getting telephone or remote consultations by prescribers. These might be nurse prescribers, pharmacist prescribers, or oncologists or medical prescribers. And these patients would remain at home while getting a telephone or a video consultation, and their treatment would be prescribed after that. Traditionally, pharmacists would be involved within the clinic. What we've found now is that we can have a pharmacist in the clinic, but we can have supporting pharmacists outside the clinic working remotely, and we've introduced standard operating procedures for remote verification of chemotherapy prescriptions. So the prescriptions are written at the clinic, but they can be checked on a different site, or even for somebody working at home. We've also introduced electronic care plans, which we keep on a secure server on our desktops that can be shared across NHS Lanarkshire, which means that if somebody's working on a patient's prescription from Hare Myers and they're working at Monklands, then they can access that care plan and see what modifications or treatments have been added or amended during this patient's treatment journey. We would also, in fact, we've also introduced delivery of medicines as well for patients to prevent them coming to hospital to uplift their treatments. Sometimes chemotherapies are available in oral formulations, and patients traditionally in the past would have come to clinic, had a prescription and brought it to the pharmacy for dispensing. Now, the patient can still get a telephone conversation at home. The prescription is checked, dispensed and distributed to the patient via a courier from the pharmacy, so preventing the patient coming out and getting potential exposure to COVID. Another really valuable tool that they've introduced into the service is Microsoft Teams. So using remote verification, as we mentioned earlier, Microsoft Teams is an integral part of how we function. It's a way of communicating across the three sites and coordinating how prescriptions are managed and processed. And this is something that we found invaluable. Microsoft Teams has got multiple uses for us in the cancer service. We mentioned the clinics. We also have operational meetings. We also have clinical meetings, and we also use it for training purposes as well. So, for example, intrathecal training, accredited training, is now managed across Microsoft Teams. So this is definitely a tool that has been a real bonus for us. So although we wouldn't want to go through the pandemic ever again, what it has shown us is that we can adapt, we can work differently, and sometimes we can surprise ourselves as to how well some of these new ways of working have impacted on us, and certainly we'll be keeping these systems going into the future. So thanks very much for listening. All the best, thank you.
My name is Lynn Hall. I'm the Chief Technician here at University Hospital Wishaw, and as you know, we've come through a year like never before, and I'm so proud of the way our pharmacy team has risen to the challenge to maintain the service for our patients during the pandemic. The pharmacy team has been involved in ordering medical gases in unprecedented quantities, and we've been involved in ordering, storing and moving stock around the hospital for various ward moves, and also stocked Udston wards from empty. The pharmacy technicians and assistants are involved in the coming days in the medical redesign, and we look forward to building on the service for our patients going forward.
My name is Emer Gordon. I'm one of the pharmacists from the emergency care team at Wishaw. One of the ways that we improved patient flow during the pandemic was the introduction of the NHS Near Me virtual clinic for anticoagulation education. We brought this in to reduce the amount of footfall coming back into the hospital after the weekend for patients requiring education on high-risk medicines. This has been well received by patients, and we've submitted a poster that's been accepted to the NHS Scotland event in June.